Professor M.C. Mishra from the All India Institute of Medical Sciences. I'll give the floor to Professor Mishra to conduct it. There are two objectives. One is we have an outcome document after the valedictory exercise that we need to firm up. Thank you.
Thank you so much, ladies and gentlemen, for your two-day deliberations. And I think the presentations were of very high quality. 124, isn't it the total number of presentations? Participants, 124 presentations. Trauma care involved from pre-hospital to post-operative rehabilitation, and every aspect has been discussed threadbare, and I am sure this will come handy, the outcome document which we circulated yesterday, and we had certain suggestions which have been incorporated on trauma registry, telemedicine, use of telemedicine in trauma care, and web portals and many other aspects of trauma care have been included, and I think the participating countries have agreed to sign the document, which we will share with the participating nations, and also will submit it to the Ministry of External Affairs to follow it up for future meetings, which may be biannual by rotation in participating countries. I welcome Dr. Jagdish Prasad, who has very kindly agreed to grace the occasion on this valedictory function. Today, we all know that he has a very busy schedule, and he could find time for this because this trauma care is also very dear to his heart. I know that he is doing whatever is possible to improve trauma care around the country. And I am also grateful to Dr. Ravikant, who agreed to come today, and he shared his views on trauma and gave overview of where he is at this time. And KGMU Trauma Center is very busy trauma center, and I learned that even trauma center which has come up with the SGPGI has been entrusted to KGMU to make it functional. So I think I congratulate him, and he is doing wonderful work at KGMU towards improving all aspects of health disciplines, including trauma care, which is very dear to his heart as well. All those who are sitting here, Dr. Bipin Batra and Dr. Vijay Sheel Gautam, Professor Riley from Australia, and all of our participating countries, delegates from Singapore, Cambodia, Myanmar, and all other countries which are here. And we had wonderful presentation from all of them. And we learned that how, like Japan, Dr. Sensho gave an idea which I think we will work on, the folding beds. That is what you mentioned, Dr. Sensho, the folding beds in case of disaster. So you don't need to stockpile the hard beds. You know, when there is disaster, they keep a stock of folding beds and then they use it. So that's a very good idea which he shared, and of course the very efficient system of disaster management in Japan. Then USA, New Zealand, Australia, all of them shared their experiences, and I'm sure we will benefit from there. All presentations have been rated very high quality presentation, and we expect that we have also invited all the participating countries to send large delegations in the World Trauma Congress, which we'll be holding next year in August. And we have shared emails, so we'll keep in touch. And both aspects, the trauma and nursing, are very, very important. As you have seen, that how significantly one can avoid pressures, ulcers, and also they can heal with the help of specialized wound care nursing. Similarly, infection control. We have brought down the cost of antibiotic usage. The overuse, abuse, misuse of antibiotic has been reduced by constant and continuous surveillance and talking to the teams. Because surgeons sometimes they are not doing things based on evidence. They just based on their impression they do. So they need to be checked. And I think the hospital infection control teams are checking everyone to maintain the hygiene, to maintain the standards, and it's a real hard work which goes into it, as was elaborated by Jacintha, and then wound care by Kamlesh. I think I must say that the nursing empowerment is what is required in India, and I'm sure that in East Asia it is already happening because we have very strong delegation from Thailand and which also involves very strong nursing presence. So, ladies and gentlemen, I again thank all the participating countries who took time out and traveled, and they contributed immensely toward the success of this East Asia Summit. I would now request Dr. Ravikant to say something, and then our chief guest.
Thank you very much, sir, for this opportunity to be here. The key point is, I call the word holding the hands. Holding the hands is a theory when a major institution moves forward and gives really a lead to others. And that is by the philosophy of being Institute of National Importance. That you run a program, you marshal it, you measure it, but then at other hospitals around in the state and the country, you give it almost at no cost. Very impressed by the nursing presentation today, indeed. Right, and that my question actually was more provocative at the end, because in the Australian manual it is the nursing which makes difference and not the equipment. So that point was really worthwhile. But the issue is still
He was a little modest, so he got intimidated by your question. Right. Why are you taking all the credit? Right. Is it equipment which is also responsible? So he was a little intimidated.
So the issue is actually now that once we are developing a protocol or a software or a say manual or a form, it should be simply uploaded on the website, and any other institution which is keen will download, and at least that infancy period and infancy cost will cut down. It will also lead to standardization all over the country. So that is very easy and simple, and we can definitely share our experiences. And why it is so critical? State of Uttar Pradesh is a state where almost 22 crore, which is equivalent to population of Canada. And politically, almost all prime ministers, almost all, except two, come from Uttar Pradesh in one way or other, because there are 90 MPs, almost 85 MPs from the state of Uttar Pradesh. So empowerment of such a major state is empowerment of country. And if such a big state is running behind in what is the progress, obviously the country is running behind. And the issue is how to make the country move forward. So it is now the time of, I say, a leading institution like AIIMS to hold the hands of others and take them out of this antibiotic access era and to go on to what you call it the standardized protocols. And I think this trauma protocol and everything is so important, because when you are young, you don't die of anything except very few tumors, 2-3 tumors, and rest everything in age 20, 30 is trauma death. Preventable, absolutely preventable. And these all three steps need to be augmented. The laws which will prevent the trauma, the technique by which will transfer the trauma, and the third, how do we manage the trauma. All three are equally important, and I think the role of state is so important, prevent the trauma, because after all, why the Middle East has the highest mortality, whereas New Hampshire has the lowest mortality. It is your modesty of how you drive. You never honk, and on the other hand, the Middle East, I would say, at 140 km/h has the highest trauma death, which we see. If we see that two buses coming at 90 km from both sides, when they collide, is actually a 180 km trauma, which is by simply energy transfer program. So it's very important that we understand this by the laws which can prevent majority of them. Because by WHO definition, a track which is having traffic like this on same road is a countryside road, is not a highway. So that is another major reason why we are having so much trauma in most of the highways. They are not developed so far. But I'm sure with the National Highway Authority, with Health Ministry, or everyone taking, and the Law Ministry, these all three handholding are required to take us out of this access trauma syndrome. And the perfection will come from meeting like this. I really thank you for this opportunity. For some time.
We request Honorable Director General of Health Services, Dr. Jagdish Prasad, to bless us by his wisdom.
Good afternoon to all. Dr. M.C. Misra, Director AIIMS. Dr. Gautam is sitting here. All the delegates from the foreign countries. Few things I just want to convey. Yesterday my secretary must have come and told you that what Government of India is doing. In the 11th plan, we took about 140 trauma centers to come up in the country, all the quadrangular north, east, east to west, and around the country. And this has been developed to, like level 1, has been developed to take from one city to another city, one capital to another capitals, and to the district levels, and ambulance at every 50 kilometers. And in hilly area it is 25 kilometers. Besides that, now what I think and what you have come here, all of you, is the need of definitely our role, Ministry of Health, or the role of the doctors, the role of the nurses, role of the technician comes later on once the accident occurs. So definitely it is a totally preventable disease. So what is required, like coronary artery is a preventable, stroke is a preventable, diabetic you can prevent to some extent, same way mental disease you can prevent to a great extent. So same way the road accident also can be prevented to great extent. So although this summit is a taking care of the trauma patients, so I will not go in detail of the how to prevent and what are the stakeholders, which has much more important role to play. Police has a very important role to play. Road Transport Ministry has to play, because especially in India, if they are making the highway, because not like India is not like America, where there is no village. Every half kilometer, 1 kilometer, there is a village side of the highway, and there is no crossing. So the road traffic accident occurs a lot, because when the people cross by running to one side to other sides. And there are so many factors involving the license, giving to the license, breakers and other things. But what Government of India has taken another initiatives in the field of the education, the trauma, is now we have developed the advanced lab support and basic lab supports module of the India, with Dr. Gautam and other team are developing. And it is developed. I think within 15 days, 20 days we are launching. And this we have developed keeping the concept that whether it is a nursing student or the MBBS students, all of them have to go in internship training of 1 week to 2 weeks in the advanced and basic lab support training once they finish their study. And this we are establishing in 67 medical colleges all over the country. Already the MCI has agreed that all the undergraduate MBBS students who passes MBBS as they get the rotation in medicine, surgery, pediatrics, another department, they will also getting these hospitals for training for the ALBLS. Same way we have written to the nursing council also that all the nurses who passes through BSc course, they must have a ALBLS training before the certificate is given. So during training period, this we are going to make it mandatory. I know that because everyone, every individual, whether it is a nurses or whether it is a technician who are staying in the ambulance, must know how to take primary care to the patient. Because it is said that, and it is true also, that first 1 hour, 2 hours is a very life-saving. And it is always taught to all of us that ABC, if you take care of the airway, blood pressure and circulation. So even the patients, they should know at least little bit things, putting the IV drips. If the blood group is available, blood group is known, because we want that police people should write the blood group of the patient on the license. That has to be mandatory. So that suppose accident takes place, the person in the ambulance must know that what the blood group is there. And what we are now suggesting to the even the people who are carrying the patients, they must keep all the blood group along with the ambulances, so that in the initial stage carrying all the patients has to be taken care of the circulations and blood loss. Because most of them, brain death, we cannot save it. If the brain death occur on the accident, roadside accidents, we cannot save. And I'm just telling why this is more important today, in today's scenario, that as we all of us know, that 60% death is today the roadside accident is a 1/10, but in coming 10 years, it will become the 1/4 of the whole death occurring in the country, because the number of the vehicle which is coming up, number of the roads which is coming up, and the way we are still are not able to stop the alcohol consumptions, it is going increasing day by day. So, and other thing which causes the accident, because recently we got surveillance of Delhi-Agra roads. You must be knowing Delhi-Agra fast traffic, expressway road. So we got survey done by our NCDC division, and what we have come to know, there is a 3-4 reason, still they are analyzing it, because every day if you see, there is a one accident occurs on the highways. Previously there was the road which was made, the tire used to get punctures and people used to, they are not able to control the vehicle. The second thing is they have found the driver who is driving the vehicles have already worked for overnight and again they are driving. So fraction of second they sleep, the accident has occurred. Because when they are still more to analyze. Third thing, they have found that the villagers who cross the road fast and accident has occurred. But it has been seen that most of the accident in the Delhi-Agra road has occurred either between 3 o'clock morning to 5 o'clock, because that time they are driving fast and they haven't slept for time being, and for a minute they sleep, the accident occurs and they die. So these are the things we have to make awareness among the people. Although we are developing that our role, whether it's a doctor or staff nurse or the technician role becomes later on, definitely it is very important that we should have a training to all these people. But these things also, it is the we who can teach them. It is the we who can tell the government that these things has to be taken care of. Because here we are discussing which is 100% preventables. If they get aware why that this country, India has out of 1.4 million deaths by the roadside accident, we have a 4.4 million deaths in our own country. So this is a huge, and the number is going to go increasing. So we have to be ready for that. And I think the 2-day summit which has been kept by All India Institute of Medical Science must have elaborated many things, as it has been told that there is a 26 lectures, but I say that all the people involved, even we have put in the national program that every district should have a general surgeon trained in the extradural and subdural hematoma, which can be operated by the general surgeon. because we cannot go on putting the neurosurgeon in every district. Number one. Number two, what we have decided now, that every district we will put 6 slice CT, so that they can differentiate. Although there is other non-invasive tests are available, but we are trying to do that 6 slice CT which can differentiate between extradural and intradural hematoma, which can be treated at the district level. Because see, our country structure is totally different. As Ravi Kanji told, that UP itself is a one country. I tell you, not UP, every district in my country is a one European country, because one district population is a 4 million population. So my one district is itself is a one European country. So we have to make the program and target like this, and we have to arrange in that way. So that way we have decided, the government has decided that in basic lab support, advanced lab support is not only the orthopedic surgeon, but technicians and even general surgeon, where the lack of neurosurgery are there, has to be trained how they can do. So this type of things are going on. And in the 12th plan, we are supposed to develop 84 more trauma centers in different parts of the country. But still it remains the thing that we have to build up the basic levels who are taking care in the ICU, how to take care in the ICU, how to take care, how to rehabilitate after the surgery, because morbidity after the trauma is also very extensive. So it is a multifarious task, multifarious department gets involved. This is the only disease, accident, where the orthopedics, general surgeons, PMR divisions, neurosurgeons, all staff nurses with the specialized training part are all getting involved. So this is a complex care which anybody is posted in these places has to be taken, complex care and complex training required. And definitely I think what he's telling that in disaster you put a foldables which you can carry the patients in things. But this is only for disaster, but other thing, when you shift the patient, you have to stabilize the things, which has to be a hard boards. So we have to teach them. We have developed, the government of India has developed the training module for the technician. Already we have developed the training module for the staff nurses who can take the care during the first hours, how the first 2 hours, 3 hours they are taken care of, so that they can reach to the hospitals and do the needful task. Because even they are going to taught how to prevent the tension pneumothorax, because many patients have a chest injury and they die because of tension pneumothorax, and putting one small tube can save the life of the patients. So these are the few basic things which we are going to teach every MBBS or JMBS. We are going to teach every staff nurse who are given the certified degree that you are now a staff nurse, you are now a qualified doctor. So they will be knowing this. And with these words, I congratulate Dr. Misra, who has organized such type of meeting, because this type of meeting is not only required in Delhi, but I think every district of the country. With these few words, thank you very much for listening patiently, and I hope that the persons who has come from all the way from different parts, they must have contributed to each others, they must have learning some things from here, and that will help in the patient's care coming from the road traffic accident. Thank you very much.
We would request Honorable DGHS to give the outcome document after it is read out, and also a group photograph to all the participating countries.
Yes. After 2 days of deliberation, we come to the outcome. 40 days ago, All India Institute of Medical Sciences was asked by the Government of India, the Ministry of Health and the Ministry of External Affairs to convene this roundtable with 18 countries. And in a short period of time, we could attract a vast amount of participants, as also evoked tremendous response in terms of the outcomes. Now, these are the outcome document that the member countries have agreed on, and I will read out what we've agreed on. We have resolved to work towards setting up an EAS web portal on trauma care and nursing, which would maintain an updated database by receiving the required support in the form of sharing data and information relating to best practices followed in trauma care and nursing by participating countries and sharing of web-based public resources. We will explore the possibility of cooperation among EAS participating countries towards setting up highly specialized trauma care units in areas and zones which are natural disaster prone and in high density population clusters. We will develop and promote human resources skilled at imparting quality trauma care and rehabilitation assistance to trauma victims, to organize training programs for teams of medical and nursing personnel involved in trauma care in order to comprehensively equip them in extending trauma care to victims of natural, chemical, biological, radiological and nuclear disasters. We will work towards developing trauma registries to support efforts to improve the quality of trauma care, to explore, to connect EAS countries through telemedicine to improve trauma care in this region, to have similar roundtable on trauma care every 2 years, hosted by members of EAS countries on rotational basis, to identify institutions in the EAS participating countries to act as mentor institutes for trauma care and nursing among member countries, and endeavor to promote excellence in trauma care and nursing research and to share outcome of such research among member countries, and to nominate focal points for trauma care, road safety and nursing, and lastly work for capacity building to provide quality of trauma care, conduct training program for nurses, doctors, paramedical personnel and first responders among member countries. So we adopt this outcome document on 16th October 2015 in New Delhi, India, and I'd like to thank all delegates and participating members for reaching these substantial outcomes. Thank you. I'll now request Professor Jagdish Prasad to give the first document of this unanimously signed outcome document to Mr. Samria, our as the nominee of the Government of India. You can carry these.
Excuse me?
Come. Amit, I think we should join it. No?
Excuse me? Sir? Excuse me, sir? May I make some comment on the... okay, after.
Just take your observations once we distribute it. It's okay.
If allowed, may I comment? Thank you very much for holding this precious meeting. And so I was given the draft outcome document last night. And actually, unfortunately, Japan could not dispatch some specialist and the government official from Tokyo to here. So I attended. I'm being here now. So actually, the embassy has no mandate on those initiatives. So we need a consultation of the government of Japan. So unfortunately, I can't sign on it today. But I'd like to discuss with the government of Japan in Tokyo. And if they agreed on it, so may I sign on after some day?
Yes, that is fine. We will record in the minutes that you have participated and you will seek consultation.
Okay. So after consultation with the government of Japan, I'll get back to you. Thank you.
Now I will request Professor Prasad to give the documents to the respective delegations. First, I invite the delegation from Australia to collect the copy of the outcome document and a copy of the photograph. I'll now invite the delegation from Cambodia. Yes, please carry. I'll invite the delegation from Indonesia. I'll invite the delegation from Myanmar. I'll invite the delegation from Singapore. I'll now invite the delegation from Thailand. I'll invite the delegate from Japan to take a copy. We recognize your support for the document. Thank you very much. Thank you very much. Yes, yes, yes.
I request Professor Jagdish Prasad, our Chief Guest, to actually hand over the plaques for the speakers and the chairpersons for the last session, sir. May I request the first plaque for the chairpersons, Dr. Asha Sharma. She is the Vice President of INC, and she remained the Principal of RAK College of Nursing for a lot of years. The second chairperson, for the session was Dr. Narit Chor from Cambodia. I'd like to call upon all the speakers of the last session. Ms. Preeti Rajesh, who spoke on nursing informatics system. Mr. Suresh Sanghi, status of ATCN in India. Ms. Sonia Chauhan, the trauma nurse coordinator system in India. Sonia. Dr. Sanjay Gupta, College of Nursing, AIIMS. Mrs. Jacinta Gujial, who spoke on hospital infection control. Mrs. Jacinta, is she there? Yeah, okay. And Mr. Kamlesh Bhairava. We'd also like to thank the rapporteurs for the session. Mrs. Nishi Giri, Nursing Superintendent of the Apex Trauma Center, and Mrs. Kripal Kaur Soki. also from the trauma center. I request Professor M.C. Mishra, Director AIIMS, to kindly felicitate our chief guest and the guest of honor for the valedictory function. Professor Jagdish Prasad, the Director General Health Services, Government of India. And Professor Ravi Kant, Vice Chancellor, King George's Medical University, Lucknow. Thank you, sir. And now I request Shri V. Srinivas, Deputy Director Administration, to propose a vote of thanks, please.
So we've reached the concluding part of the roundtable, and I feel quite nostalgic. Last 40 days have been a lot of hard work from our side, and I'd like to thank Professor M.C. Mishra ji for the leadership role that he has given. I'll also introduce the team that has worked in it. Dr. Manish Singhal, could you just stand up, please? Dr. Amit Gupta, Dr. Krishna Swagar, Mr. Arun Kumar Singh, Mr. Pallal Sitesh, Mr. R.K. Sharma, Mr. Chamoli. There are also Dr. Kalpana Luthra, who's not here, and Professor Kharbanda, who's also not here, who worked very hard on it. A warm round of applause for all of you. So thank you very much, sir, and it's a big mandate that we've fulfilled, and we invite all of you for lunch. There's also a visit to the... There's a lunch at conference hall. There's a lunch at conference hall. After the lunch, we meet there only. And there is a visit to the JPN Apex Trauma Center. Thank you very much.
So the JPN Trauma Center is little away. So after the lunch, please take your stuff away from this place because we will not come back here. So all the international delegates, please take your stuff after the lunch so that you will not come back here after the round.